Hello, YouTube family. This is Dr. Erica. Thank you for joining me on this particular video. Thank you for subscribing and thank you for sharing and also hitting that like button as well. On this particular video, I am going to talk about a nasal steroid spray called Nasacort OTC for allergy season. Okay, this medication is no longer prescription as of 2014. It is only available over the counter as a allergy medication, nasal spray, steroid. And it works by working locally on the nasal mucous membrane to help with runny nose, allergy season symptoms. Okay, now the directions will depend on how well the individual is handling the side effects, how well the individual is actually becoming more and better with tolerating the allergic rhinitis. So first the patient is going to start off by priming the actual spray bottle, and they're going to do that by shaking the suspension in the bottle about 5 times, and then they're going to actually instill 2 sprays twice a day. 2 sprays twice a day. Then they can decrease that over time as their symptoms get better to 2 sprays once a day. And then once they feel a whole lot better, they can decrease that amount to 1 spray once a day. The cost for this particular medication is economically recommended. It is about $15 for one bottle, and then you'll double the price as you get a double twin pack over the counter. Okay, and it is equivalent to the prescription strength, so I do recommend it. Again, the pricing may be a little bit high for a twin pack, but it is available as a single pack at about $13 to $15. I just checked here lately, one of the retail corporation pharmacies. So this medication, again, it is very effective and it takes some time to work. It takes about, I would say, 3 weeks for the patient to actually feel complete relief. Now, they may at 12-hour use begin to feel some relief, but after 3 to 4 days, they'll begin to feel more and more relief. And then after about 3 weeks, the maximum effect is taking place at that time. So do be aware of that. In the meantime, patients can take oral pseudoephedrine, oral nasal decongestants such as the phenylephrine capsules as well as the pseudoephedrine capsules as well, 6-hour relief or 12-hour relief in the meantime. Also, they can take an antihistamine to help with that as well. Nasacort is a nasal spray that should be taken around the clock. It's not a PRN medication, or I'll take it only if I need it, just to feel a little bit better here and there. It is a medication that can be taken twice a day, 2 sprays until relief occurs. Once relief occurs, then you want to dwindle down to 1 spray per day. And then after you feel better, then you stop after the 1 spray per day. But do not discontinue taking the medication once you've begun taking it. And you want to, again, take it around the clock for best effect. So do remember that. Some of the drug interactions with this medication are very small. There's not a whole lot of drug interactions with this particular medication. It is a steroid, a topical steroid, so it's not systemic. With systemic steroids, we expect all sorts of side effects like edema, change in heart rate, or hypertension. We expect other drug interactions when we take it by mouth for consumption. So we want to just minimize other oral steroids that may be that could be taken with the medication. So do remember that. Adverse effects can be like nasal burning, sneezing. Also, before you use the medication, I want to make mention, before using the medication, go ahead and make sure that the nasal passage is clear and clean. Okay, make sure the nasal passages are clear and clean you might want to make sure that the nose is being blown, all of those mucus um, is being released before actually making these sprays, because the corticosteroid is going to have to act by actually being placed on the mucous membrane, okay? Sore throat and nose bleeding may be some side effects as well, so do be alert. And again, you want to shake the bottle very well before actually administering the medication, and you want to store it in a cool, dry place away from sunlight. Now, it's good to be taken with pregnancy patients and with lactating patients. It's pregnancy category C, so it is safe. Just do make sure that the healthcare provider is contacted. If there's a nasal damage or a unhealed nasal wound, do not take the medication via the nasal passage. Also, there's upper respiratory tract infection as well. Do not take the medication. If the patient has any sort of systemic, untreated fungal, bacterial, or viral infection, do not take this medication as well, because the steroid can have some adverse effects. Okay. And again, you want to clear the nasal passages of all secretions before applying the medication. And the prescription strength is no longer available. It's only available over the counter in your cold and flu symptom relief medication area. Okay, and then you're going to shake it very well about 5 times before actually utilizing the medication. Okay, and then do remember that it does take at least 3 weeks for the maximum benefit. So do use oral nasal decongestion, such as your pseudoephedrine 30 milligram. Also, your 12-hour relief of the pseudoephedrine that you can purchase over the counter as well. So do remember those. All right, so that's all that I had for you today on this particular video. If you have any questions or comments, please let me know in the comment section. Please also subscribe and share with others as well. Please binge watch on other videos that I have concerning allergic rhinitis. It's under the playlist, mainly under discussions of health topics. So do please binge watch on all of those videos as well. So thank you for joining me. I'm Dr. Erica signing off, and I hope everyone has a great evening. Bye-bye.